and welcome to today's live show about 10 amazing breastfeeding facts to blow your mind. Do you know any breastfeeding facts? Have you ever learned something that has truly blown your mind about breastfeeding? I know that I have quite a few mind-blown moments along the way throughout my breastfeeding journey. So my name is Chelsea Curley. If you haven't already virtually met me yet, I am from Team Thompson and I am a mum just like you. And I found myself in a bit of a sticky situation at the beginning. So now I am here and I love sharing as much about the Thompson Method with you guys as I possibly can squeeze into these short periods. So tell me where you're from. Let me know a little bit about your situation. Introduce yourselves below. We love hearing from you and we love connecting. That's what it's all about. And here I am introducing you to, well, I suppose something you may not know, but you may already know. And that's 10 amazing facts about breastfeeding. So let's get started. And the first one is something that I didn't know before I started breastfeeding, but when I found out, I was telling everyone, and that is breastfed babies typically get less sick. Did you know that? So breastfeeding lowers the risk of ear infections, diarrhea, stomach problems. It has amazing gut influences, probiotics that are natural to the body. Babies who are not breastfed actually have a higher risk of asthma, diabetes, and other diseases like obesity. But of course, before we do get deep into these breastfeeding facts, it is really, really very important that we say that we fully 100% support the right and the decision of every mother and how she chooses to feed her baby, because it's your baby, it's your body, and whatever works for you, you will know your baby and your body best. And whatever works for you, we fully support that. So please, if you're watching this and you have something that you consider a different experience to what you believe I'm talking about, please don't feel like you have failed or that this isn't for you, because it absolutely is. Knowledge is power. So number 2, and that is the health benefits of breastfeeding are for you as well. So if you're breastfeeding, the process of breast milk production has health benefits for mum as well. So the longer you breastfeed, the greater the benefits, but breastfeeding lowers the risk of breast cancer, ovarian cancer, and weak bones, cardiovascular problems, and obesity again. And it is truly liquid gold. And I know that there are lots of other benefits for mum as well. So please do have a look further into that. Obviously, I can't squeeze them all in to one show, and I certainly can't remember the massive list of benefits for both mum and baby. But the actual health benefits itself are truly incredible. I actually have a quote about that I'm going to share with you guys a little bit later, and about something that the World Health Organization has said on the health benefits of breastfeeding. So liquid gold, number 3. Liquid gold. So before your milk volume peaks, which is usually in the first few days after giving birth, your breasts make a thick, highly concentrated golden fluid, which is called colostrum. Did you guys know that? Did you know that before your milk comes in, it's colostrum? You'd still have a fluid there, which you may not visibly see. I didn't myself. And that's why it's so important to really learn and understand how your body works to produce that liquid gold. So your baby only needs a small amount to feel full and stay healthy until your milk fully comes in. And I hear from so many women around this stage, and they're falling into top-up traps when they don't want to, with formula being forced on them before they're really ready for that, or even if they don't want that. Because they're being told that their precious liquid gold isn't enough, when this isn't the case for many women. A majority of women actually don't need interventions in those early days. They just need, and their team just needs to know a little bit more about how the body works to produce breast milk, and how the hormonal stimulation works as well. So this is avoided with education and support. And I just want to stress again that actually, if this is you, there is absolutely no judgment. It is very common, especially in some countries, that formula is introduced within those first early days. And although, yes, it does sometimes have an impact on breastfeeding, especially with the introduction of an oral device like a bottle. But that doesn't mean that breastfeeding is still not possible for you. Reach out, let us know. What we're trying to do, our aim is to share this knowledge with as many women as possible during pregnancy, so that they can avoid the common pitfalls I'd say, that they may want to avoid if they know. So it's all about informed decisions. So you can make a decision based on your unique situation, on what your choices are, and make sure it's an informed one. So did you know that introducing formula can delay your milk coming in? Did you know that? So that's something to be aware of. So just before I move on to lovely fact number 4, I just want to say that the Breastfeeding Club, which is our members group, our private members group, in the Breastfeeding Club, there's just so much. There's a wealth of information and resources on those first 72 hours. So not only does Dr. Robin go into great detail about the first breastfeed, so those all important 3 golden hours, but she also describes how your body is working to draw out that colostrum in those first days. Like I said, the first 72 to 96 hours, how your body works to produce breast milk unique to you and your baby. So if you would like more information on the Breastfeeding Club and being fully prepared for birth and breastfeeding, especially those all important few days where you establish breastfeeding, and maybe things won't go to plan, it's important to be prepared in any circumstance and know what to do. For example, if you're separated from your baby or your baby needs a short period in the NICU. So comment below, comment yes if you would like some more information. So number 4, your baby can smell you. Of course, your baby has been in utero, smelling you, tasting the amniotic fluid, being beside your heart and just being whole with you. And now they're out here in the big scary world, but they have these beautiful natural instincts, as do you. And that is that they can smell you, they can feel you, they can touch, and they can see just a little bit of you. And newborns have a strong sense of smell and know the unique scent of your breast milk. So that's why baby will turn his or her head, and Dr. Robin explains this much better than me, but when he or she is hungry, he or she will search for the breast. So again, another reason why the 3 golden hours are so very important. If you want to learn more about the 3 golden hours, have a look through our free guides or get in touch below. Like I said, in the club, in the online education, there's a wealth of information on this, and Dr. Robin has a unique perspective working both in the hospital system and many years at home birth in her private practice as well. So get in touch. We love connecting with you. Number 5. Now this is where it gets seriously interesting for me. So as many as 80% of mothers stop breastfeeding, are forced to stop breastfeeding before they want to. I was almost one of those 80%, and I know so many women, so many friends, family members who are forced to stop in those early days. And when I say forced, I don't mean necessarily, sometimes it is necessarily told you need to stop. What I mean is they are in circumstances or going through common complications which could have been avoided with the right education and support. So Dr. Robin has found that this is likely because of the common breastfeeding complications. So this could include nipple pain, high milk volume, reflux and colic, breast engorgement, mastitis, for example. So yes, that is very crazy. If you ask me, things like fast flow, high milk volume before breastfeeding, I would have thought was a good thing. However, it is not. It can really upset baby's gut. It can be very painful for you as well. There are many more breastfeeding complications, but in Dr. Robin's research, and we'll get into that now, those are a list of the most common complications and why women are forced to end breastfeeding before they want to. Now, many believe that, let me put that on the screen again. Many believe that women end breastfeeding before they want to because of returning to work, but that is not actually what is seen in recent studies and in Dr. Robin's extensive research. The main reason, the number one reason, is nipple pain and trauma. So in Dr. Robin's PhD breastfeeding research, nipple trauma was the number 1 most common presented complication in 62.9% of women. Nipple trauma was associated with commonly taught techniques, which you may have seen us talk about or Dr. Robin teach in the online education if you have the program, but also here in the group, there's a wealth of information on that as well. And this involved the cross cradle hold and the maneuvers to the breast, like the nipple to nose. And that really did result in the baby having nipple malignment and a lot of asymmetry in the face to breast, which is what Dr. Robin talks about in great detail. So if you want to avoid or maybe even overcome in those early days, breastfeeding complications like nipple trauma and pain, because for me, it was the reason I almost gave in, and it was hard. It was emotionally and physically painful. It was hard. As a family, it was obviously not very nice for Sam to see me in distress. Baby was getting a bit distressed as well, because I was clearly in pain, and they can feel that, can't they? So nipple pain and trauma is not very nice. And if you have experienced it yourself or are experiencing it now, I'm so sorry. My heart goes out to you, and we know what it's like. So please do get in touch. And if you're a new mum, don't worry about nipple pain. Don't let that bother you or stress you or give you anxiety, because it can be avoided. The key principles of the Thompson Method are based on evidence. They are evidence-based and proven to have helped hundreds and now thousands of women to enjoy pain-free breastfeeding from the start. And those that don't have access to a wonderful supportive community in the Breastfeeding Club, and they're able to work through those minor bumps in the road before they become bigger complications. So if you're concerned about latching issues or other breastfeeding complications, maybe you've experienced struggles previously, or you know someone who has, and you're really worried about it, or maybe you just want to learn. That's what this is all about, right? Being fully prepared and learning, expanding your knowledge. I'd love to connect with you. So please do introduce yourself below, and I will be in touch as soon as possible, because I love speaking to you ladies. That's why I do what I do. I'm here to share as much as possible. So, number 7. If breastfeeding, this is from the World Health Organization, so if breastfeeding was scaled up to a near universal level, so about 820,000 child lives would be saved every year. So I'm just going to say that again, because it is a very, very important statement. If breastfeeding was scaled up to near universal levels, about 820,000 child lives would be saved every year. Globally, only 14% of infants, this is a global figure, under 6 months are exclusively breastfed. Obviously, that figure is a lot better than some figures like here in the UK, for example, where it is 1%, which are exclusively breastfed before 6 months. And in Dr. Robin's research and in resources found in UNICEF UK and the World Health Organization websites, they all have conclusive evidence that women initiate breastfeeding at pretty decent breastfeeding rates. I think some are in the 60s and 70s in most countries, and they drop within the first month, some even sooner, because of introduction of formula bottles and lack of support and education. And this is why it's our main aim to double world breastfeeding rates through education and support. Not only do we have the online program, but obviously now you may have seen that we have our Thompson Method professionals out there in the community with you. So we've recently had our newly qualified Thompson Method professionals. So some are practitioners, some are educators, and they are there in the community with you. And we have just opened the doors for another round of the Breastfeeding Academy. And us here in the community of the Thompson Method are so very excited about this. Dr. Robin Thompson herself and Rachel have worked endlessly, and a lot of our other senior team members have worked tirelessly to bring this to hospitals, professionals, and communities near you. So we are very proud and excited for this. If you want to learn more, obviously, again, just get in touch. Number 8, there are more than 200 constituents of breast milk known to science. I mean, if that's not a mind-blowing fact, then I am not sure what is. I mean, it's just beautifully insane, isn't it? There's not really much else to say on that. So, human milk adapts to babies' needs. Did you know that? This is not something that I knew, and I'm really, really interested in sharing a quote with you now, which I'll read out. So Mary, I think her name is Futrell, Mary Futrell. So she's a professor and pediatric nutritionist at the University College of London here in the UK. And she published a peer-reviewed study, a very, very amazing piece of research of breastfeeding. And she said, bear with me, human milk varies over the course of lactation, over the course of the day, from the start to the end of the feed. That's every day. and to some extent on maternal factors such as diet. Breast milk is constantly changing. It's a constantly changing fluid. So in a way, it's a moving target, with some components still not fully understood today. Now, the reason I chose to read that quote out is because when I saw it back when my little one was very small, maybe 4 or 5 weeks old, I remember constantly panicking that my milk wouldn't be enough. And then especially when baby got to about 5 months old and the feeds became shorter, I suppose I just needed to trust my maternal instincts. But of course you worry, especially as a first-time mum. And I should imagine that when my second baby arrives in November, not only will I be more educated thanks to the online education and Dr. Robin, but I'll be more confident because, of course, I've done it before, and also because I have the education there to allow me to really tap into my gut instincts, which are the most important thing. So the reason I chose that quote, like I was saying, is because I was in a position where I didn't fully understand the power of breast milk and how it has all these magical scientific abilities, and it really does adapt to everything. So if baby's feeling poorly, it will adapt to that. If baby needs more hydration because it's hot, or baby needs extra fat because of whatever reasons their body knows, and so do your breasts, and so does the hormonal process of breast milk production. So have you heard of that before? Did you know that? Tell me if you know anything in addition to that, because there is so much more to the power of breast milk, let's say. So my 10th and final fact, amazing breast fact, is about the antiviral properties of human milk. So breast milk antibodies have been found in over 80% of milk. And this is milk samples from women infected with COVID 2019. So did you know that there have been studies done on women who have had and have got COVID-19, and their antibodies have been found in 80% of breast milk? I mean, how amazing is that? So if you have COVID, or you've been poorly, viral infection or something similar, and you're worried about passing it on to your baby, please go out and do your own research. Read up on it, go to trusted websites, speak to your health professionals, and I'm sure they will tell you how very special it is and how important it is to continue breastfeeding. But if you want to know more about that and you need support, because it's very hard and can be very overwhelming in those early days, especially if you're experiencing challenges or you're poorly, etc. So get in touch. Like I said, introduce yourself below, get the conversation going. So before I go, ladies, families, professionals, whoever you are watching, I just want to let you know that on the 3rd of August, so that's a few weeks from today, here in this group, I will be hosting, and I'm very excited to be doing so, a free live webinar. So what we're going to do is we're going to set up and share details on the whereabouts and the timings of the group to make sure it suits as many as possible. But the live webinar is going to be based on avoiding the common complications of low milk volume. So if you're concerned about low milk supply, or you've experienced this previously and you're pregnant and preparing for your breastfeeding journey, then this is perfect for you. So yes, I will be having a conversation with you guys about what we see in the Thompson Method and how being fully prepared can really, really help you. I'm really excited to reveal some awesome things there as well. So August 3rd, right here, you'll see me, and it is a free mini webinar. So don't forget to register for that when the details come out. Keep an eye out. So before I go, I just want to say thank you all for your support. We've had so many beautiful success stories recently come through, and we are just so in love with them. Keep them coming. Dr. Robin is over the moon with how this journey has ended for her, but how it's starting for her in a sense. And when I speak to her, she is always overwhelmed with support, kindness, love, and she wants to give that all back to you guys. So thank you again, and I will see you on the 3rd of August, and tune in next week. Myself and Dr. Robin will be going live on Dr. Robin's page. If you haven't got the details for that, then just search Dr. Robin Thompson on Facebook or pop us a message and we will direct you. And we will be talking about some tips to avoid breastfeeding complications. We'll see you then. Take care, guys.